Have you ever wondered why cancer is one of the deadliest diseases in the world? It's a vexing question that has puzzled humanity for centuries. A question that has led to thousands of research studies, billions of dollars invested, and countless lives touched. Cancer, a word that carries so much weight, so much fear, so much uncertainty. But what is it really? How does it happen? Why does it happen? And most importantly, can it be prevented or even cured? These are questions that have sparked curiosity and fear in equal measure. Questions that have pushed the boundaries of medical science, and questions that have shaped the course of countless lives. This journey will take us to the very heart of these questions, exploring the intricate depths of what we know, what we don't, and what we're still discovering about this complex and formidable disease. So stick around to uncover the hidden truths about cancer. First, we must understand what cancer is. At its core, cancer is a disease of the cells, those tiny units that make up the body's tissues and organs. Now, normally, our cells divide and grow in an orderly way, replacing old cells and repairing tissue. But cancer disrupts this process. Imagine a city where traffic flows smoothly with cars representing cells. Then suddenly, a few cars start ignoring traffic rules. They multiply recklessly, causing congestion. That's what happens with cancer. These rebel cells or cancer cells multiply without control, forming a mass called a tumor. Now, not all tumors are cancerous. Some are benign, which means they don't spread to other parts of the body. They might cause problems, but they're generally not life-threatening. On the other hand, malignant tumors are the real culprits. They can invade nearby tissues and spread through the bloodstream and lymphatic system to other parts of the body. But how do these cancer cells differ from our normal cells? Well, there are a few distinct characteristics. First, they're immortal. Unlike normal cells, which have a lifespan, cancer cells can divide indefinitely. Second, they don't obey signals from other cells to stop growing. They're like the cars in our city analogy, ignoring the traffic lights. These rogue cells also have the ability to invade other tissues, something normal cells can't do. And finally, they can evade the immune system, our body's defense mechanism against diseases. They put on the perfect disguise, making it difficult for our immune system to recognize them as a threat. The impact of these cancer cells on the body varies depending on where they are and how much they've spread. They can affect the normal functioning of the body's systems and organs, leading to a wide range of symptoms. Knowing the nature of cancer provides the foundation to understand its causes and stages. So, stay tuned as we delve deeper into this topic, shedding light on the causes, stages, and treatments of this complex disease. We'll also discuss how we can lower our risk of developing cancer. So, let's keep the conversation going. Now that we know what cancer is, let's delve into its causes. Cancer doesn't discriminate. It can affect anyone, regardless of age, gender, or socioeconomic status. But what exactly causes this disease to develop in the first place? Well, it's a complex puzzle with several interlocking pieces. Let's take a closer look at some of these pieces. Firstly, genetics plays a pivotal role in cancer development. We all inherit genes from our parents, and some of these genes can increase our susceptibility to cancer. These are often referred to as cancer genes. However, it's important to note that inheriting a cancer gene doesn't automatically mean you'll develop the disease. It just means you may have a higher risk. Next, let's talk about lifestyle choices. Choices related to diet, physical activity, and tobacco and alcohol use can significantly impact our cancer risk. A diet high in processed foods and low in fruits and vegetables, for instance, can contribute to the development of certain types of cancer. The same goes for a sedentary lifestyle, excessive alcohol consumption, and tobacco use. Now, on to environmental factors. Our surroundings can also influence our cancer risk. Exposure to certain chemicals and substances such as asbestos and radon can cause damage to our DNA, potentially leading to cancer. Likewise, prolonged exposure to the sun's harmful ultraviolet rays can cause skin cancer. Lastly, certain infections can also lead to cancer. Some viruses and bacteria can change healthy cells into cancerous ones. For example, the human papillomavirus, or HPV, can lead to cervical and other types of cancer. It's essential to remember that not everyone exposed to these factors will develop cancer. It's a complex disease with many contributing elements. The interplay between our genes, lifestyle choices, and environment determines our individual risk. Understanding these causes can help in the prevention and early detection of cancer. With knowledge comes power, and by being aware of these factors, we can make informed decisions about our health and well-being. Cancer is not just one disease, it has different stages. As we delve deeper into our discussion on cancer, it's important to understand that it progresses in stages. These stages provide crucial information about the extent of cancer within the body and guide the treatment options. Cancer stages are usually expressed in Roman numerals from stage 0 through stage 4. Stage 0, often referred to as in situ, is the earliest stage where abnormal cells have not spread beyond their original site. It's like a seed that hasn't started growing roots yet. As we move to stage 1, the cancer is small and localized. It's as if the seed has started to sprout, but the plant is still young and small. At this point, the cancer is typically easier to treat and chances of survival are generally favorable. Stage 2 and 3 indicate that the cancer is larger and may have started to spread to nearby tissues and lymph nodes. It's like the plant has grown bigger and its roots are reaching out, making it harder to remove without affecting the surrounding area. Lastly, we reach the most advanced stage, stage 4. At this point, the cancer has spread to distant parts of the body. It's as if the plant has grown into a tree, with its roots and branches reaching far and wide. Treating stage 4 cancer can be challenging, and often focuses on improving quality of life and easing symptoms. Each stage may also be subdivided further, using letters and numbers to provide even more detail about the cancer, such as the size of the tumor and the extent of spread. Remember, the stage of cancer does not change over time. Even if the cancer shrinks, grows, spreads, or comes back after treatment, it's locked in at the time of diagnosis. So a person keeps the same stage if their cancer comes back years after the initial diagnosis. The stage of cancer at diagnosis greatly influences the treatment approach and the patient's chances of survival. Understanding the stages of cancer helps doctors to formulate a suitable treatment plan and provides the patient with a realistic prognosis. Cancer does not discriminate. It affects people from all walks of life, including celebrities. Let's take a moment to acknowledge some familiar faces who have faced this battle. Olivia Newton-John, the beloved Grease star, has been candid about her journey with breast cancer. Robert De Niro, the iconic actor, underwent treatment for prostate cancer and came out victorious. Pop legend Kylie Minogue, too, faced down breast cancer with resilience. These are only a few instances from the long list of celebrities who have had cancer. They underscore the fact that no one, regardless of fame or fortune, is immune to this disease. Their experiences, broadcasted in the public eye, have shed light on the reality of cancer, its impact, and the importance of support during this trying time. These celebrities' stories serve as a reminder that early detection and treatment are crucial. So let's continue our discussion by delving into the various treatments available for cancer. While cancer is a formidable disease, it is not unbeatable. The journey to overcoming this illness is arduous, but with the right treatments and medical advancements, it becomes less daunting. In the medical world, there are several treatment options for cancer. The choice of treatment depends on various factors, including the type and stage of cancer, the patient's overall health, and their personal preferences. Let's explore these treatment options. We begin with surgery. This is often the first line of attack against cancer. Surgeons work to remove the tumor and some surrounding healthy tissue to ensure no cancer cells are left behind. The goal is to remove as much of the cancer as possible, making it easier for other treatments to work effectively. Next is radiation therapy, which uses high-energy waves or particles to destroy cancer cells or slow their growth. This treatment can be done externally, where a machine directs radiation at the cancer, or internally, where radioactive substances are placed inside the body near the cancer cells. It's a powerful tool in the fight against cancer, and is often used in conjunction with other treatments. Chemotherapy is another widely used treatment method. It uses drugs to kill cancer cells throughout the body. These powerful medicines are designed to attack cells at different stages of growth, and are particularly useful in treating cancers that have spread to various parts of the body. However, because these drugs also affect healthy cells, patients often experience side effects like fatigue and hair loss. Then, we have immunotherapy. This is a type of biological therapy that boosts the body's natural defenses to fight cancer. It uses substances made by the body or in a lab to improve or restore immune system function. This approach can be incredibly effective, especially in treating certain types of cancer that have proven resistant to other treatment methods. Finally, there's targeted therapy. This treatment focuses on specific genes, proteins, or the environment that contributes to cancer growth and survival. By blocking these abnormalities, targeted therapy can cause cancer cells to die. This method is often used in combination with chemotherapy and radiation therapy. These are just a few of the numerous treatment options for cancer. Each one has its strengths and weaknesses, and what works best will depend on the individual patient and the specifics of their cancer. It's important to remember that every patient's journey is unique, and treatment plans are tailored to meet their specific needs. The battle against cancer is a tough one, but it's a battle that countless people are winning every day. With each passing year, medical advancements offer new hope and better outcomes for those diagnosed with this disease. Despite the daunting diagnosis, advancements in medicine provide hope for cancer patients. The fight against cancer is not easy, but it is one that can be won. And with continued research and innovation, the future of cancer treatment looks brighter than ever. Prevention is always better than cure, even when it comes to cancer. This timeless maxim holds true, especially in the context of cancer, a disease that has affected millions globally. So, how can we prevent, or at least lower the risk of cancer? Let's start with a healthy lifestyle. What we eat and how active we are plays a significant role in our overall health. A diet rich in fruits, vegetables, whole grains, and lean proteins can provide our bodies with essential nutrients and antioxidants which can help prevent cancer. Regular physical activity not only helps maintain a healthy weight, but also reduces the risk of certain types of cancer. Smoking and alcohol consumption are two of the most significant risk factors for many types of cancer. Therefore, quitting smoking and limiting alcohol intake are vital steps towards prevention. It's never too late to quit, and the benefits begin immediately, regardless of how long you've been smoking or how much you drink. Next, let's talk about screenings. Regular checkups and screenings can detect cancer in its early stages when it's easier to treat. For example, mammograms can detect breast cancer early, and colonoscopies can find polyps that could turn into colon cancer. It's crucial to talk to your healthcare provider about what screenings are right for you based on your age, family history, and lifestyle. Avoiding known carcinogens is another important step towards prevention. This may include avoiding exposure to certain chemicals and materials at work and in the environment, and protecting ourselves from the sun's harmful ultraviolet rays with sunscreen and protective clothing. Lastly, getting vaccinated against certain infections that can cause cancer, like hepatitis B and human papillomavirus, can also lower your risk. Remember, these are preventative measures and not absolute guarantees. However, they significantly reduce the risk and are steps we can all take. Remember, your choices today can impact your future health. We've covered a lot today, from understanding what cancer is to how we can prevent it. We've unraveled the mystery of this disease, a condition that can sneak up on any one of us, regardless of our lifestyle choices, genes, or the roll of life's dice. We've learned that cancer is not one disease, but many, each with its own stages and causes. We've talked about the stages of cancer, from the earliest, most treatable stage 1 to the advanced, often challenging stage 4. We've also looked into the many causes of cancer, from exposure to harmful chemicals and radiation, to unhealthy lifestyles and genetic predispositions. We've taken a moment to remember celebrities who had their own battles with cancer, reminding us that this disease knows no status or fame. We've also explored the many treatments available, from surgery and radiation therapy to chemotherapy and targeted therapies. But most importantly, we've discussed how to prevent and lower the risk of having cancer. We've discovered that a healthy lifestyle, regular checkups, and early detection can make a huge difference. Cancer might be a formidable foe, but it's not unbeatable. Knowledge is our most powerful weapon. By understanding what cancer is, how it works, and how to prevent it, we can arm ourselves against this adversary. Yet, the fight against cancer is not a solitary one. It's a battle we're all a part of. Every bit of awareness, every nugget of knowledge, every shared experience can make a world of difference. And that's where you come in. Each one of you has a role to play in this fight. Whether it's by sharing this video with others, encouraging your loved ones to get regular checkups, or simply by staying informed, you're helping to turn the tide against cancer. If you found value in watching this, please hit the subscribe button and leave a comment so that we can respond to you. Together, we can fight the battle against cancer. Because remember, knowledge is power, and in this fight we're all in it together.